Hi, I'm Dr. Norm Hall, president of Simpson University. Over a year ago, Shasta County Health Officer Dr. James Moo declared a public health crisis due to a severe physician shortage, followed by a request from the leadership of Shasta County Board of Supervisors to commission a coalition of local healthcare, business, and community professionals to explore whether the North State should pursue development of a medical school to help address the region's growing physician shortage. I was asked to serve on that commission, and through that process, the idea emerged that Simpson University could potentially serve as the host institution for such a great effort. That conversation was grounded in a very real concern: access to healthcare across the North State region. In response, the coalition, in sync with Simpson University, began taking a serious, disciplined look at whether we could help be part of the solution. So, of course, we engaged physicians, healthcare leaders, accreditation experts, hospital systems, and universities across the country that have successfully launched similar programs. We studied what works, what does not work, and what it truly takes to build a medical school capable of serving its region well over the long term. Recently, the Simpson University Board of Trustees unanimously voted to endorse advancement of this ambitious initiative. With that endorsement in hand, it is important now to share some of the overarching plans and guiding principles beginning to come into focus. We, of course, understand that a project of this scale deserves careful public review and thoughtful questions. That is why this process has included feasibility analysis, financial modeling, accreditation planning, implementation timelines, and evaluation of regional clinical capacity. What we found, the need is significant. The opportunity is real, and the potential impact for the North State could well be substantial. Across much of the North State, physician supply remains below recommended levels. Patients often wait weeks for care, traveling long distances for specialty services, or struggle to access care altogether. At the same time, recent research by the Association of American Medical Colleges reports that over 40% of California's physicians are within 5 years of retirement. For decades, healthcare systems across the region have worked hard to recruit physicians from elsewhere, and we are grateful for those who choose to serve here. But recruitment alone is not enough. National data consistently shows physicians are far more likely to practice in the communities where they train and complete their residency. That's why this conversation is ultimately about building a long-term physician workforce pipeline for the North State. At Simpson University, this is personal. For us, for our faculty and staff, we live here. Many of our students are from here. This is our community. For more than a century, Simpson has prepared students for lives of service and leadership in communities that need them most. We have already seen the impact local healthcare education can make through our nursing program, whose graduates now serve throughout the North State in clinics and hospitals and healthcare systems. That experience reinforces an important truth. When healthcare professionals are trained locally, they are far more likely to remain invested in the region long term. What we are proposing is the development of a College of Osteopathic Medicine designed around the needs of rural and underserved communities like those throughout our North State. So it's time to introduce Salute Education. Simpson University has entered into a strategic alliance with Salute Education, sometimes referred to as Medical Impact Company. And they will help guide the development and launch of this proposed medical school. Their leadership and affiliated teams have helped develop a significant number of osteopathic medical schools currently operating in the United States and include experienced medical school leaders, accreditation specialists, and operational experts. That experience matters because the challenge is not simply imagining a medical school. The challenge is executing one successfully through accreditation, operations, clinical partnerships, and long-term sustainability. At the same time, Simpson brings something equally important: long-standing relationships throughout the North State and a deep understanding of the communities this initiative is intended to serve. Together, we believe this creates a realistic and responsible plan grounded in demonstrated need and guided by experienced leadership. The proposed model is intentionally designed for this region. Current planning anticipates an inaugural class of approximately 100 students, allowing the university to grow deliberately, strengthen operations responsibly, and expand clinical partnerships over time. As part of the planning process, the university has evaluated multiple facility models, including renovation of an existing 85,000 square foot commercial building or construction of a purpose-built medical school facility on Simpson University's campus in Reading. Both models have undergone preliminary financial and operational evaluation as part of the university's long-term planning process. As you would expect, the university has, of course, evaluated the financial structure required to responsibly launch and sustain a medical school of this scale, including accreditation, startup capital, faculty recruitment, and long-term operational planning. Under accreditation requirements, a significant financial escrow must be established to ensure long-term institutional stability and protect students throughout the life of the program. Importantly, the university remains open to partnership opportunities, alternative locations, and models that could integrate future clinical or healthcare services into the project over time. Rather than relying solely on a centralized campus approach, the program will operate through a distributed clinical training network anchored in Reading and extended across hospitals and healthcare providers throughout the North State and beyond. Students would train within the very communities that need physicians most. That experience reinforces something we have already witnessed firsthand. Locally trained healthcare professionals often develop deep professional and personal ties to the communities they serve. I'm not talking possibles here. I'm talking from experience where we know that our nursing school students have stayed and served in our region. The North State already possesses an existing network of hospitals, clinics, and healthcare agencies that could serve as the backbone of this system. With the right partnerships and coordination, this initiative has the potential to strengthen the region's long-term healthcare workforce in meaningful ways. There is also strong demand to support this effort. California produces just 21.1 medical students per 100,000 residents compared to the national average of 37.9, ranking 43rd nationally, despite producing one of the nation's largest medical school applicant pools. As a result, many qualified students leave the state for medical education, creating a significant opportunity to expand mission-aligned medical training within California, especially in the North State. The osteopathic model is particularly well aligned with the needs of rural communities. Nationally, osteopathic physicians are significantly more likely to enter primary care and practice in underserved areas. This model emphasizes community-based care, whole person medicine, and long-term patient relationships. The impact of this initiative could extend far beyond education alone. Over time, it has the potential to strengthen healthcare access, support workforce development, create jobs, and contribute to the long-term vitality of the North State. At the same time, we recognize that public trust must be earned. Any future investment, particularly public investment, must be tied to accountability, measurable progress, operational readiness, and responsible stewardship. The proposed initial $10 million county investment is viewed as a critical catalytic commitment that would allow the project to move from exploration into formal execution. Those early funds will support accreditation readiness, architectural and engineering work, legal structuring, site development, and early stage implementation necessary to matriculate the first class. Just as importantly, such a commitment serves as an anchor that would help unlock substantially larger private, philanthropic, and institutional investments necessary to complete the project and satisfy accreditation requirements. At the heart of this conversation is a larger question. What kind of healthcare future do we want for the North State? For generations, this region has depended heavily on others to meet many of its healthcare workforce needs. Today, we have an opportunity to begin building something here, a long-term physician workforce pipeline capable of strengthening healthcare access and supporting communities across the North State for decades to come. This effort deserves thoughtful review, important questions, and continued public transparency. And we also believe it deserves serious consideration because of what it could mean for the future health and stability of our region, and for our families and our children's children. Simpson University has long been the North State's hometown university. For generations, this region has supported us and entrusted us with preparing students to serve communities throughout the North State, California, and beyond. Now, we believe we have an opportunity and a responsibility to step forward in an even greater way. Not simply by building a medical school, but by helping build a stronger healthcare future for the North State. An ecosystem, if you will, can start here, now. And we look forward to continuing this conversation together. So, in closing, I invite you to review the full proposal and learn more. Please visit simpsonu.edu/medicalschool. It's my sincere hope that this will serve as the underpinning for good and responsible conversations with friends and family, and that we can do this together. Thanks for listening.